Welcome, everyone. This is our Aging in Place, Creating a Safe Home Environment presentation. We're happy to have you all here today. I'm going to introduce our speakers. We have 3 speakers today, and they will present, and then you can feel free to put your questions in the chat and or ask them in person at the end. First presenter today will be Linda Bohmbach. Linda is the co-founder and vice president of sales and marketing for Healthsmith, which specializes in providing custom solutions for unmet accessibility needs that enable people to live fuller lives. Linda is a graduate of Lamar University in Beaumont, Texas, with a BS in speech communications, holds an executive certificate for home modification program, is a certified dementia practitioner, as well as a senior home safety specialist. She serves on the board of the Visiting Nurse Home and Hospice and is vice president for the Portsmouth Business Association. She is also president of the Professional Women in Building, which is an affiliate of Rhode Island Builders Association. Our second speaker will be Stephanie Mediate. Stephanie is the director of rehabilitation and intake operations for Visiting Nurse Home and Hospice. Stephanie graduated with a BS in physical therapy from the University of Vermont in 1995. Following graduation, she began her career at Spalding Rehabilitation Hospital in Boston, Mass., where she was initially trained in orthopedics. Stephanie has an interest in geriatrics and neurology and became specialized in stroke rehabilitation. Stephanie is an APTA certified clinical instructor, mentoring students throughout most of her career as she loves education and teaching. After her time in Boston, she continued her career working with patients in skilled nursing facilities until taking a position with Visiting Nurse Home and Hospice. Stephanie initially worked as a physical therapist in the field and now serves in a leadership position as the director of rehabilitation and intake operations. Cindy Sanchez will be our third speaker. Cindy is a family support specialist at Habitat for Humanity of Rhode Island, Greater Providence. She is a medical assistant by trade and obtained her certification as a community health worker and certified Aging in Place specialist in the summer of 2021. The Aging in Place program offered at Habitat Providence through the generous contribution and support of Blue Cross Blue Shield Rhode Island focuses on helping older adults make aging in place home repairs and modifications to help them live home longer and age in place. The program offers comprehensive health and home assessments, a basic package of aging in place modifications, including grab bars, handrails, lighting, etc., all free to the participant with a value of up to $1,500. So go ahead, Linda, I'm going to turn the floor over to you and you can go ahead and begin. Thank you.
Thank you. So what is aging in place? The Center for Disease Control defines aging in place as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. So the many problems that we're seeing with this is the increase in aging population, also the demands that this is putting on the professional health and social service organizations. Obviously, current home environments are just not fitting the needs of aging residents. And most importantly, seniors want to remain at home despite their physical challenges. As we've gone and learned in the past 2 years, COVID-19 has really been a push to keep the loved ones at home versus in facilities, and obviously fall risk.
One of the key factors for aging safely in place is prevention of falling. Every second, someone over the age of 65 falls. 1 out of every 5 of these falls causes an injury, including broken bones and head injuries.
Excuse me, Linda, can you just speak a little louder, please? We're having trouble hearing you.
Sure, let me move closer to Linda. A key factor for aging safely in place is the prevention of falls. Every 1 second, someone over the age of 65 falls. 1 out of every 5 of these falls results in an injury, including a broken bone or a head injury. Every 15 seconds, an older adult suffers a fall that requires them to go to the emergency room. Are you able to hear me better?
Perfect.
We really look closely at the risk factors of falls. Some of them can be controlled and some of them we can't. One that we can't control is vision. We can control it by getting them glasses. We can't correct the vision all the time, but usually, so someone that has decreased vision, maybe they're blind, they can't see things that are in their way, so it impacts and creates a risk for falls. Weakness, their sensory impairment. Some people can't have sensory impairment in their feet and they can't feel the change from a carpet to a hard floor, from the grass to the sidewalk. It increases their risk for falls. Incontinence is a really huge risk factor for falls. People are getting up in the middle of the night to run quickly to the bathroom to make sure that they don't, they're not incontinent. And oftentimes that's when we see a lot of falls. Many patients are one fall away from losing their independence at home. Falls are very costly. Over $50 billion per year is spent on fall prevention and the cost of falls. This picture is near and dear to me. We call it headquarters. It's where patients spend most of their time. Everything they need is within reach. Their phone, their medications, their water, their Lifeline, their remote control. When we look at a patient's home, we really need to look at how they navigate their whole home, not just their headquarters. Oftentimes family members go into their home and their mom or their grandma, they look really safe and they look okay. But what happens is when they get up, there are a lot of issues that could cause them to fall. Moving out of the headquarters really helps us to see their needs and limitations. It helps us look for potential fall risk and needs in the home. Where should we look? We should look everywhere. If they go in the basement to do their laundry, we should be looking there. If they go in the yard to feed pets, we should be going there. So when we go for visiting nurse to visit a patient as therapists, we start outside the home. Can they get in and out of the car safely? Is there a walkway to enter the home, or do they have to cut through the grass? Do they have to go in the front door or the back door? Do they need a ramp or a lift? How do they get out in an emergency? One of the biggest things we see in home health is patients have a nice sturdy rail to get into their home, but when they get to the top step, they can't manage opening the door and their walker or their cane, or they can't manage that last threshold step into the house. We often put a little handle or a door pull right in the door frame between the exterior door and the storm door, and that gives them just enough support to get up that last step into the home.
So to follow up what Stephanie was just talking about, these are just some examples of some exterior modifications. So again, the lever door handle, the door pulls that Stephanie mentioned, getting up to that last threshold, proper lighting, whether it's lighting above the door or pathway lighting going into the home. And then the bottom left picture is a great example of just a single straight entry into that home. There's obviously no thresholds there, and then it's an easy access right into that home. Again, some different examples with regards to thresholds, foam ramps. The big lug is the one that is on the right side. So again, it's the picture showing the rails and the small ramp that is going exactly into the home with the blue door. But again, just some other examples for easy access into the home.
Once we get into the home, we start in the kitchen. We look at the kitchen chair. What kind of chair do they sit in? Can they push the chair in and out? Oftentimes we'll take a dining room chair that has nice sturdy arms and put them in the kitchen to help them be able to get up to the table. How do they carry their food and drinks to the table? There are trays that we can add to a walker to help them safely carry. A lot of our patients we see leave their walker to carry their plate or their coffee cup, again, putting them at risk of falls. Can they safely use the stove or oven, or does it need to be turned off? Is there a chair by where they're cooking that maybe they need to sit and take a rest? So these are a lot of things that we look at in the kitchen.
So again, some kitchen modifications. Again, task lighting, which is the one that's in the middle, that again shows easy access for someone that's able to walk into a kitchen. It might be dark in an older home. The picture on the right is the electric drop-down kitchen cabinets. And the one thing that's always important to note here is it doesn't have to be every single cabinet in the kitchen. It could just be one cabinet that could have this type of controls on it. That might be a cabinet that that individual can easily put in a bunch of the items that they're using on a daily basis. And then the picture on the left just shows you the pull-out drawers. Again, if they're able to access it from a walker or a wheelchair.
Next, we look at the living room. What kind of chairs are they sitting in? Is there an adequate chair? Many patients insist on sitting on the couch, and the couch may be too low, or it may not be safe for them to get up or down from. Is there a phone near the chair? Is the pathway clear? Is there clutter to get from the living room to the bathroom? How do they get to the bathroom in a hurry if they really have to go? We really look at area rugs. We look for wires. A lot of clients in my job, we would suggest picking up a small area rug. We would roll it up for them and we would put it away. And then when you come back the next week, it's back in place. If that's the case, we need to make them as safe. It's their home. They've had that rug for 50 years. They want that rug. We look at taping down the edges, because what will happen is the back leg of the walker will get caught and it will roll up. So really, yes, there are things to make people safe, but we really have to look at, it's still their home and they still want it to look a certain way. We also look at we spend a lot of time on the chairs. Is it stable? Does it rock? A rocking chair can slide on a wood floor and really get them into a lot of trouble. Is it safe for them if they have hip precautions? Maybe they had a hip surgery. Is the chair too low?
This product that can be used in the living room are some very affordable, economical products. The one on the bottom left shows a couch cane with an assisted tray. So that tray does swivel, and that individual is able to hold on to that cane as they're getting up off the chair or the sofa. And this goes underneath just one side of that chair or that sofa, and that's holding the weight down on that. Another one can just be the couch cane without the swivel tray. And then the security pole and curved grab bar. So this is tension mounted, floor to ceiling tension mounted. It locks every 45 degrees, and it can be used in various locations. It can be put next to a sofa, as you see here, a chair. It can be used in the kitchen next to the bed. And then we'll talk about ways and show you ways that you can use this in a bathroom in a couple other slides. Some additional products for the living room. Obviously, the electric lift chair, as Stephanie mentioned. Again, the security pole and curved grab bar. But the other product is a Royal Easy chair. So Stephanie mentioned in a couple previous slides where it's sometimes difficult to slide that chair in and out and get in and out. So with the Royal Easy chair, this has a lever that is in the back of that chair that lifts up and then has two wheels that drop down that can easily just roll an individual into and back out of a table. Some additional products, Easy Stand and Go. This is an easy, affordable one. As you can see, it just slides under cushions. So obviously the furniture would have to have the cushions in there. There's the two levers or pulls, I should say, on there that allows that individual to just lean up, put their weight on that to lift themselves up. The Easy Up portable seat is, again, can be manual or electric. So this is a great option for that individual to take if they're traveling, going to a restaurant, to church. And again, it's just giving them that little bit of lift to help them stand up. The lever extender, which we show in the bottom right, is for a lot of individuals that are currently using an old type of lazy boy chair that has the wood handle. And again, it gets difficult as that person ages to really maneuver that handle. So there is an extender out there, can be attached to enable them to just maintain their favorite chair that they like.
In the bathroom, we start by looking at the flooring. Is the flooring level? Is it slippery? Is there an area rug that, again, needs to be taped down or removed? We really look to make sure they can get on and off the toilet safely, especially looking at balance when they're trying to manage their clothing, their pants, and their hygiene. We see a lot of people in old homes who tend to grab onto the towel bar for safety and balance, which really puts them at risk as it can come out of the wall and they can have a fall. Oftentimes, if we change the towel bar to a grab bar, it's cosmetically it looks nice. And I know Linda has some that look really nice. It really isn't that, people don't want their bathroom to look like a handicap bathroom, but it's really important to keep them safe. So we really look at everything in the bathroom to make sure they're safe, including the next slide, which is the shower. Is there a tub seat available? Is there some place, how do they get in and out of the shower? Do they need grab bars? Again, are they grabbing onto that towel bar? Is there a non-skid surface in the tub? Are they trying to take a bath and they shouldn't be? And one of the last things we always look at is there a handheld shower or something to help bathe them?
This is an example of universal design for the bathroom. There are a few that we show here. The one in the center obviously is showing the seat. It does have the handheld shower that is there as well. And again, it's an easy access, no lip into that shower. Then you also have the one that's on the bottom left. Again, you can see that the has the toilet rails right next to the toilet. I'm not sure if you're able to see it, but you can see that the mirror is also at an angle. And also there's easy access to get roll up or stand next to the sink. So again, it's easy access for someone that is in an actual wheelchair. The one that's on the one that's on the right is showing the wall mounted sink. So again, this is one that is used a lot. It does have a very large rim that someone can access their toothbrush or their soap or something along those lines, especially if there's a caregiver involved here as well. And then again, it's easy access to just roll up underneath that sink there. Some additional products, again, you can see the variety of them here. The one that's in the middle is the PT rail, which again, we see in a use of in a lot of the older homes. So as you see, there's the tub, there is the toilet, and then obviously there would be the vanity that would be next there. Obviously, there's no room there to actually install an actual grab bar. So this is another example that you can use these PT rails. They can be attached to the wall, or they can also be attached to the floor with the floor mast. The super pole with the super bar, again, this does swivel, but it's allowing that person to just hold on to something for mobility to stand up off the toilet. Some additional products, bath lifts are very popular. People love to take their baths. So this is something that remote control can easily just then remote down into the tub and then allow access up. Tub cutouts, again, there are a number of companies that are doing tub cutouts, which can be an affordable solution to instead of getting a walk-in tub. The picture that's on the right is a great example of showing that the vanity, the toilet, and the tub, again, no place to put the actual grab bar there, Florida mounted. This is going to swivel to allow that individual to get up off the toilet, as well as turn it around and access the tub if need be. And then there are a variety of toilet seat risers that are used throughout, anywhere from a 3-inch all the way up to a 5-inch. But again, to allow easy access off the toilet. The toilet incline lift is again another affordable solution. You're not replacing the entire toilet. You're just replacing the motor, as you see here, as well as the lid. So again, think of getting up off out of a lazy boy chair. Same idea, remote control. The grab bars are there. And again, it's allowing that individual to have ease of access to get up off the toilet.
Really important. A lot of our loved ones and patients are really embarrassed to tell people they can't get in and out of bed. One of the first places I ask people in their home is to just show me, how do you get in and out of bed? And oftentimes I find people that can't get their leg on their bed, or they end up crooked in the bed, or they can't pull up the covers, or they're not even sleeping in the bed, they're sleeping in their recliner. There's a lot we can do in the bedroom to help them. We can make sure we can add a small bed rail to the side of the bed, not a big, huge bar to make sure they don't fall out, a little small handle just to help them pull themselves up at night when they need to. We really make sure they can get to the bathroom from the bedroom. Is there clutter in the way? Does their walker fit beside the bed? We really want to make sure they're safe. Sometimes we have to recommend a commode, or for the men, a urinal at night, just to make sure they're not rushing to the bathroom and they don't have a fall.
Some bedroom solutions, obviously you can do the smart technology, which is not on here, but there's a lot of new smart technology that is out that can, ask Alexa, for example, or Echo to turn the lights on when they get up. What we show at the bottom of this on the left-hand side, it is actually a mat that you can stick either on the floor. You can also do it as underneath them in the bed. so that as they lift the weight up off of that, the light next to them will automatically come on. Again, lever types of switches are also great to use. And then just another simple solution would be a glow in the dark cup, so that it does stay glow in the dark, obviously when the lights are off. But if this happens to accidentally get knocked over, the water will not spill out. As Stephanie talked about bed rails, there are a variety of bed rails for every different type of solution. One that I'd like to point out is the bed caddy. So this can be attached to the end of the bed, base of the bed, and then it is like a ladder rung. So it would sit on top of the comforter. So again, as that individual is starting to get up, they can use the ladder rung to get them into a semi-sitting position. And then we would obviously recommend either a bed rail or a type of PT rail next to the bed, so that they then, as they're swiveling over to put their feet on the floor, they now can put their right hand on their bed rail or the bed cane to allow them to just get that mobility and get the balance. But again, it does depend on the different types of mobility and the situation that's going on with regard to bed rails. Ceiling lifts and sit-to-stands are, again, some obvious solutions that I'm sure everyone may be aware of. But again, it depends on the situation. If there's, how many caretakers involved and how, what is the mobility of that individual. One thing we always like to recommend is, ask your vendor if you offer rentals. It's always important because some vendors out there do offer short-term situations.
Next thing that we're going to look at on the stairs. We really look to make sure that there's a good sturdy railing. Is there one railing or two? And most importantly, is the railing long enough to get to the top of the stairs? Some of the older homes that we see, the railing is short of that last step. And the last step is really where people are at risk of falling. We also look at the surface of the stairs. Do we need to add non-skid treads to make sure they don't slip on the stairs? Finally, people that have maybe surgery or maybe use a walker, how do they get that walker to the second floor if they live alone, or maybe their caregiver isn't well enough to carry, needs to hold on to the railing to get upstairs? So oftentimes we'll recommend a second walker that they put on the second floor, so when they get there, it's there for them. For people, we utilize the senior centers or the Masons if they're not able to afford a second walker, or oftentimes they can borrow one from a friend for the short term.
So following up on that, obviously some stair lifts are a good solution for this. Again, I always recommend that you ask the vendor if they do provide rentals. Stephanie talked about the non-skid stair treads. Again, something that can easily be done. And then vertical platform lifts. So these can be used, available up to 14 feet. These can be used also in garages or outdoors. And again, there are some vendors that do offer rentals for these. But the important thing to make sure is to really make sure that the company that you're going with does have factory trained technicians, because that is very important, especially in this time.
The next thing we look at is flooring, and I always include footwear in flooring. We want to make sure that we look at the scatter rugs. We've talked about that. We look at the surfaces, maybe the thresholds to get from one room to another. A small threshold can catch the walker, can catch a cane, can catch someone's foot. We also really look at, is it slippery? A lot of our clients like to use powder in the bathroom, which really makes the bathroom like an ice skating rink. So flooring is really an important part of safety. Again, we spend a lot of time on footwear. Are they wearing slippers that don't fit? Are they walking barefoot or in socks? Other things that we look at is the phone within reach. Do they have a Lifeline? For those of you not familiar, I think most people are. Lifeline is the button that they can push that if they need help, if they get in a situation where they have a fall or they can't get out of bed. Many of our clients are afraid to don't wear their Lifeline. It's hanging, we get there and it's hanging on the bedside table. It's hanging on the head of the bed, especially when they go into the shower. Lifeline is waterproof and they should be wearing it in the shower, but they don't want to get it wet, and that's where they could have a fall. We spend a lot of time looking on oxygen safety, making sure they're not going to trip over the oxygen cord and where it's going to go. And how do they get out if there was a fire or an emergency? We look at the devices, we always look at the devices they have. Many people have loaner devices. It was their fathers, it was their cousins, it was their uncles. Is it the right size for them? Is it the right shape? And does it fit everywhere in the home? There are a lot of different places where we get the equipment. We use the medical vendors for many of the items that are covered by insurance. Walkers, wheelchairs, canes, pharmacies. A lot of clients like to use Amazon. They get it quick, they get it fast. You have to be a little bit careful with Amazon. We had someone order a tub seat from Amazon and it came in several parts and they were they able to put it together. They did save money from some of the vendors, but they weren't able to use their insurance if it did cover the item, and B, it wasn't put together for them. The senior centers are such a valuable resource. Each town has a different senior center, and some senior centers have equipment and some don't. Some require a deposit and they give it back to you when you return the equipment. It really depends on each area, but senior centers are great for short-term use or if people unable to afford or obtain the equipment. During COVID, there was a real struggle with Hoyer lifts to get them because all the equipment vendors were out of them. And some of the senior centers had them that were donated and different places that we could use. The Veterans Administration takes care of their own. There's a lot of equipment to be from the veterans. And one of the really important places I want to bring up, if you don't know about it, is the Freemasons. It's the Robert Allen Medical Center up in Warwick. Right now, because of COVID, they're only open typically on Friday morning. They have a lot of equipment that was donated there. Personally, for my dad, he was able to get a Hoyer lift from there, a portable ramp from there. They have walkers, they have hospital beds. It depends, you have to call. Some weeks they have a lot, some weeks they have nothing. It's things that people donate when they pass away or if they don't need it any longer.
This is just a slide of some adaptive household aids. Again, some products that are affordable that clients can use, whether it's a keychain to help them open up the door, whether it's something to help them steady their hand with writing, the long handles, combs and brushes, as well as for showers. And we all know about the leg lifters, but again, I go back to the smart technology. It's so big that it can really help individuals either as a reminder, keep in contact with family members, help to answer the phone, change the channel if it's hooked up properly. So there's so much that can be done now with technology. These are pictures of the Accessibility Living Suite that we have opened here at Home Healthsmith. And it is designed as a suite that people can come in and really try, touch, and feel the various accessible equipment. We have an accessible kitchen, bathroom, living room, bedroom. We showed the drop-down picture for the kitchen cabinets as an example. The front of the house is giving access to a vertical platform lift, also through a ramp, and then the stairs that are on the other side. But again, it was really designed so people can come in and see how things can look in a home and not look so institutional and medical.
Have an elevator.
And we even have an elevator, you're right. This is something that I had brought to Stephanie's attention a while back. It's an oxygen management system. We actually found it for personal use with my father. So he was one of the ones in hospice that, just had to go everywhere. But this is a remote control oxygen tube that dramatically reduces the risk of falling and tripping over the oxygen tubing. So it again is remote that can push a button to either retract the excess tubing or dispense the tubing as needed for travel. So again, something that we just really thought was important to bring to everyone's attention.
Support services at home. Now that we've talked about all the equipment, we do also want to take time to talk about the services at home. The first one, of course, is home health care. That's what I do at the visiting nurse. It's intermittent skilled care. It's short term. Did they have surgery? Did they have a fall? Or they have an illness? We're there to bridge the gap when they need help the most. We have nurses, therapists, social work, home health aides, and hospice. Most importantly, when patients leave a hospital, they're often told they need home health care. A lot of people think this is forever and this is going to help us forever. It's really just intermittent, short term. The private care is the long term. They need for example, we go in for home health care and we recommend a home health aide to help the patient take a shower twice a week. The family and the patient, it's really something they probably need forever. It really helps them with their independence. It really helps them. When we discharge from the visiting nurse, they need to continue on with private care. So oftentimes we'll utilize our social workers and our team to help them to find and to get private care to continue forever. The government and nonprofit agencies also, Meals on Wheels is wonderful. There's a lot of local programs in each community that can help people. With home health aid, with home health care, patients have a right to choose which agency they're going to use. So that's really important. And the same with private care. There's no specific agency that they have to use or can use when they should be given a choice in the hospital, and they should have a choice for the private care.
Is private pay, obviously, health insurance. There's also the Rhode Island Livable Home Modification Grant Program, the long-term care insurance providers, life insurance, and the bank loan, second mortgage, and reverse mortgage are just some of the few in terms of some funding sources. Other possible sources, Centers for Independent Living. There's various private organizations. You see the ones that are listed there. But there are many more that are available, and it really depends on the situation. We always like to say everybody's situation is completely different. So again, depending on what the mobility and that's the health situation that they're going through really depends on some other possible sources. And that is the end of our presentation.
Thank you, Stephanie and Linda, for that information. And I see you have your email message addresses there if anyone has questions they'd like to contact you directly. We're now going to turn the program over to Cindy Sanchez. She's from Habitat for Humanity Providence. So Cindy, if you want to bring yourself up on the screen, I don't know if you have slides. You can do that now.
Hi, how are you?
Hi, Cindy.
Hi, everyone. Hi, it's good to be here. Thank you very much for allowing us to present our program. And Mark Kravitz, the Executive Director for Habitat for Humanity of Greater Providence, is joining us too, and he will be helping me with the presentation as well. So I will hand it over to him, and he will start the presentation.
Thank you.
Great. Hey, good morning, everyone. And Cindy jumped in. I think, Cindy is so engaged on the day-to-day. When you said, can you present a PowerPoint? We're like, let's tag team this together. So I hope it's okay with you for me to jump in, and it's good to meet you all. And thanks for the opportunity. Cindy said, my name is Mark Kravitz. I'm the Executive Director of Habitat for Humanity of Rhode Island, Greater Providence. And we're excited to present to you today our Aging in Place program. So without further ado, I'll jump right in. And Cindy, I'm going to cover sort of the big picture, and Cindy's going to cover some of the programmatic details moving forward. Take about 10 minutes. So now that you're all familiar, you're obviously familiar with the concept of aging in place, and similar to the previous presentation, it provides the necessary resources and home repair modifications so that older adults can live safely, independently, and comfortably in their home for an extended period of time. And I'm sure that I'm preaching to the choir here when I say that housing is a major social determinant of health. Earl Chambers, an associate professor from the Albert Einstein College of Medicine, stated it perfectly for me when he said that during an interview with the Urban Institute, I view housing as a linchpin social determinant of health that influences many others. If you intervene on housing, you have the chance of affecting so many other social determinants of health. Now, I would like you to imagine you buy a house, you and your spouse raise 4 children there. 3 boys and a girl, you're happy. After 30 years, you pay off your mortgage. 6 months later, your spouse dies. With Social Security and what's left of your spouse's pension, you've been making ends meet, but you can't afford both your heart medication and the eye treatment that your doctors have been recommending. You decide to forego the treatment. Not seeing well makes you nervous, and you sometimes snap at the grandkids. Their visits become less frequent. One day, a nice man stops by and quotes you a price of $150 to fix the porch. You're going to use that money for food, but you know the work really needs to be done. You give him the money to make the repairs, and he leaves without doing the job. You feel like you can't trust anyone. You're angry and scared. The house isn't safe, but it's your home. All of your happy memories are here. No matter what, you don't want to leave. I wanted to share this example case study because it highlights so well many of the challenges that Habitat for Humanity hears about daily from older Rhode Islanders. The statistics that you see here on this slide speak for themselves. The bottom line is that Rhode Island has a fast-growing older population of Medicare and duly enrolled Rhode Islanders living in homes, and in many cases desperate for home modifications that would allow them to live in their home longer. As a result, the combination of not making these necessary home modifications, along with an increase in disabilities, will likely result in the increase of expensive emergency department visits and hospitalizations, thus putting much more pressure on Rhode Island's healthcare system. And as we know with COVID, there's a lot of pressure on that system currently. To make matters worse, many older Rhode Island adults are facing dire financial challenges. More and more Rhode Island households face the question of putting food on the table, paying their utilities, or fixing that leaking roof. For older Rhode Islanders, this is often a point of intensive mental stress and anxiety. With the financial support of Blue Cross Blue Shield of Rhode Island, Habitat for Humanity of Greater Providence has launched a new Aging in Place initiative. Our program has three primary goals. The first is to provide modification upgrades to the household. The second is to engage and support older volunteers. And third is to collaborate and leverage other organizations that provide home-based services and support for older Rhode Islanders. This is a new program for Habitat for Humanity of Greater Providence. However, it builds on the more than 34 years of home building experience, as well as 17 years of experience that I bring in the areas of healthy housing, home modifications, energy efficiency, workforce training, and collective impact. This initiative has also joined a coalition of dozens of other Habitat affiliates around the country, participating in Habitat for Humanity International Signature Aging in Place program. So that's it. I'm going to hand it off to Cindy, and she's going to kind of talk through the details regarding eligibility and how the process works.
Thanks, Mark. So our first program goal is to repair and modify older Rhode Islanders' homes to meet aging in place industry standards. These standards focus primarily on home safety and comfort, fall prevention, and universal design modification interventions. Our target participants are older adult homeowners aged 65 and above who are between 30 to 60% of the area median income. However, we will work with homeowners up to 80% of the area median income. To show proof of income, they are allowed to show proof of other state and federal assistance, that is income qualifying, such as Medicaid, LIHEAP, SNAP, etc. Additional requirements include that the homeowner show proof of up-to-date homeowners insurance and also be willing to partner with Habitat. The program is holistic because it combines the expertise of a certified aging in place specialist with Habitat's knowledge of housing construction and universal design. Through an initial home assessment, we will identify opportunities for modifications that improve safety and mobility. I conduct 5 health and well-being assessments, which include activities of daily living, instrumental activities of daily living, a full risk assessment, PHQ-9, and a social isolation scale questionnaire. And all of these assessments allow us to assess or have an insight into the general health and abilities of the homeowner to perform their everyday tasks. And I will also conduct an education session with the program participants. This provides valuable information and tips, and will also help identify additional needs. I will also make referrals as needed to local agencies and other nonprofit services that provide support for older adults. To pay for the modifications and other home repairs, the participants will be offered a grant up to $1,500. For more expensive measures above and beyond the $1,500, that will require a 0% interest loan. However, we are seeing that a majority of the measures are getting completed under the $1,500 grant. Some examples of the modifications that we do include handrails, grab bars, stair treads, lighting under cabinets in hallways, smoke and carbon dioxide detectors, removing carpets, decluttering, minor repairs, moving the washer and dryer from the basement to the first floor, fixing stairs, such as basement or front stoop, and even installing ramps. And at the moment, we have a manageable pipeline of households that we're working with as we, continue with the program process, and that is increasing every day, thankfully. The second goal of the program is to engage Rhode Islanders with the opportunity to volunteer. The growing number of older Americans gives not only opportunities to work with homeowners, but also a wealth of older volunteers. Older volunteers are often more dependable, experienced, skilled, and good leaders and connectors. At the same time, these volunteers will appreciate learning new skills to take home with them. Also, by staying active and socially engaged, volunteering with Habitat creates an effective way to maintain personal health. This makes me think of one of our core volunteers, Jamie German, at the age of 76 and a retired chemistry teacher at Moses Brown. Jamie is on the job each and every Saturday, womaning the Middersall. She is such an inspiration to all volunteers, but especially the young women. The program will work to foster partnerships with organizations that connect with older adults. And if you're an organization that provides volunteer experiences for older adults, I hope that you will reach out to discuss ways to get engaged. And you can, I'm sorry, hold on one second.
So Cindy, if it's okay, I can jump in here at this point and cover the third goal of the program. And in this case, it's to work holistically with local partners. So the likes of Linda and others. Linda and I have been playing email tag, so we're looking to connect in the next week or so. But we're looking to address non-housing issues as well that confront many older people, such as personal health management, socialization, meals, transportation, housekeeping, etc. An aging in place perspective moves the discussion beyond just making the home improvements and home modifications to building partnerships, advocating for a livable community for people of all ages, and networking with other service providers. In partnership with Blue Cross Blue Shield of Rhode Island and others, Habitat will and continues to work to build on the good work of organizations such as Age Friendly Rhode Island that has brought together, made up of organizations willing to work together to provide additional in-home services above and beyond the home improvements and modifications provided by Habitat. And again, these areas of focus include organizations that offer assistance with socialization, personal health, management, healthcare, lifelong learning, wellness, safety and security, and other services. From the beginning of this program, we have been collecting information to assess how well we are meeting our anticipated outcomes. This includes pre and post work assessments and surveys, as Cindy described it earlier. One of our organization's core tenets is to collect and utilize data to regularly improve our programs and to assess our program outcomes and impacts. As you can see from this list, our program's anticipated outcomes are focused around the participants' improved functionality, confidence, improved health, and overall well-being. Our organization's commitment to data collection and analysis will also help us to assess for impacts that have larger community and societal benefits. As the healthcare landscape continues to shift toward a value-based care framework, being able to show the societal benefits is essential. So in closing, Habitat for Humanity of Greater Providence's Aging in Place program helps older adults age in place in the homes and communities they love. Through our Aging in Place program, Habitat for Humanity of Greater Providence and its partners will provide products and services that foster safe and livable homes and communities. This program will help older adults achieve the strength, stability, and self-reliance they need to build better lives for themselves. And again, we are so appreciative of the opportunity to present our program, and we'd be happy to take questions. I do want to, if it's okay, just for a second, to show you very quickly how to make a referral or how to sign up for the program. We have a very basic form on our website. If you just go to Programs, Home Improvement, Aging in Place, and you scroll down, you will find an application, an information form to complete, either as a referral or as the homeowner themselves. And it just provides some very basic information. This goes directly to Cindy, and she will get the process going with that family. We will complete the application however is easiest for that individual. We can go to their home, they can come to the office, we can do it all online. Cindy can interview and complete the forms for them, etc. So we're making it as easy as possible. Individuals are welcome to call Cindy directly or to email her directly as well, which is cindy.sanchez@habitatpvd.org or homeimprovement@habitatpvd.org. So that's our total program. We're excited to present this to you all. And again, we hope you would reach out. I think it's a great opportunity for many older Rhode Islanders.
Thank you all for this great enlightening presentation.